Okay, so here we're going to talk about formation of a tooth so you can learn the three dimensions of it. I've taken a little ball of Play-Doh. It is a little bigger than egg yolk in your hand, and you can model with this tiny little piece, or you can model with huge pieces clumped together, or you can even make tiny little ones with something the size of an almond. But here we have this one little model. I'll roll it into a nice piece. We'll take it and we're going to start making a lower central incisor. So I'll roll it between the palms of my hand to give it a carrot shape. The teeth are kind of long, anterior teeth particularly, so it gives you quite a bit of shape immediately. And we'll go in and you start making it flat. Now flat in two dimensions. You'll make the root flat in one dimension, and with the thumb and the finger you'll make the crown separate. You see, it's starting to form like a tooth automatically. You give it a little bit of curvature, and it's starting to look like a lower central incisor very rapidly. And here you have it. Central incisors is going to have sharp edges on both sides and nice wide incisal edge, but everything curves in and it looks like that. And then on the mesial and distal aspect of the root you have depression that also shows anatomically inside the mouth, and there's supposed to be curvature onto the tooth. That's how it looks like. And in order to make the CEJ, we can assume one is a distal, and in distal aspect the CEJ rides occlusally but is wide, and there's more distance between the incisal edge and the CEJ compared to on the mesial. It rides more close to the incisal edge and it is pointier compared to the distal. And here you come down and boom, you have nice CEJ on the lingual aspect. Now the lingual aspect is slightly more coronal as the CEJ is placed compared to the facial aspect, and you start seeing a tooth develop very nicely and very rapidly. Now incisal edges of central incisor are fairly sharp and they are pointed in both mesial and distal. The way you can tell the mesial of a central incisor is where the CEJ is. If CEJ is pointed, that's the mesial. If it is broad compared to the other side, then that's the distal. So that's a good measure. If you want to make this a lateral incisor, then all you got to do is round off the distal edge just a little bit. It becomes a lateral incisor. Incisally, when you look at it, if you see the long axis of the root and you hold it perpendicular to an instrument, you will realize that the incisal edge is directly perpendicular 90 degrees to the root surface. For a lateral incisor on the right side, the incisal edge is twisted towards the right. So if this is a long axis, you notice that the incisal edge is twisted inwards. On the left side, it is going to be the other way around. You see, if this is the root surface, then the incisal edge is twisted the other way around. And of course mesial and distal are different. We can take the same tooth and we can start making it into now an upper central or a lateral. The difference between the lower and the upper one is, in the upper one you would have the root which is conical shape almost, with flat end towards the outside and pointed kind of end towards the lingual side. And you do the same thing, you start making the incisal edge and it's starting to look like a lateral incisor. Lateral incisors are rounded on the side, and of course the root curves distally on a lateral incisor and the mesial is pointed. So this looks like a lateral incisor. I'm not going to put a CEJ right now, but you'll know how to put the CEJ. And what you do is you have a fossa in the middle, lingual fossa, and normally there's a lingual pit right there. And you mellow it out. So there'll be a lingual pit, and in diagnosis you must check there to make sure there's no caries there, because that's where dens and dentes is, and that's where the cavity starts, right at the lingual pit. And the tooth is not perfectly straight, it is supposed to be slightly curved, and that's how it goes. You want to make this into a central incisor, make the side much more pointier, make the crown wider compared to the lateral incisor root proportion wise, just like that. And the distal is rounded but not too rounded, and you notice the transformation that now the crown is a little wider and root proportions remain the same. is triangular in cross section. If you look at it, lingual is much thinner, it's almost like a ridge, and the facial is much broader. And when you look at the radiograph, this is how the proportion would be for the upper central incisor. So this is tooth number 8. 8 means upper central right, with a nice sharp pointed mesial, rounded distal. And of course you can add the CEJ anytime you want, but in this demonstration I'm not really interested in adding because I showed you on the lower central, but this is how you can add the CEJ. One thing to remember in CEJ formation is that it's not a groove. CEJ is not a groove, but it is a proportion of enamel sitting on top of cementum of the root. So it's something which is covering. If you look at it from side point of view, it seems something excessive. So it's not a groove. And when you're doing it in composite formation also, please don't put a groove there, but you put the enamel. So enamel should end as a nice bump on to the cementum. And here you have it. This is a central incisor. We can take this and we can start making it into a canine. You see that? It's trying to form a canine, just like that. And you fold the inside, and the distal is wider, and the mesial is not that pointed. And here's a canine now. Okay, and on the lingual, you mellow it in. And for the lower canine, what you'll notice is lower canine is a lot more moon-shaped than the upper one. Upper one is also longer, and again the root tip goes distally, and the proportions are much longer, and it goes just kind of like that. And that's the canine. We can take this, and now we can go to a lower premolar. Very simple. Round it off, and you go into the lower premolar just like that, and you make it flat and start making it look like a premolar. And lower one, first premolar, is broad facial lingually, narrower mesiodistally on root, but it's starting to kind of look like the upper central incisor in root form, because now you're beyond the curvature on the arch. You take this, and it looks like the canine, but you go in and you have nice deep central fossa and the grooves, and on the mesial you have a groove that comes down. This is a general form. We are not doing wax ups here. It's not going to be that precise. And here kind of you have it on top of the ridge. We have the sulus way and mesial as well as distal. And I'm using the back of a scalpel to do the sculpting. The first premolar has a lot of pseudo cusps, if you would. It's starting to look like that, and what we'll do is I'll go ahead and put a additional groove on both sides of the facial cusp, which is also functional, and it forms fairly quickly and nicely. And when you look at the facial profile, you have to realize that, let's put a little CJ first, so you get appreciation of what we are doing. Distal is broader. So here we have CEJ2, and it's not a groove, but facial you'll have a nice flat surface. That's a facial functional cusp on the lower first premolar. That's how it goes. And you can take the same one and you can change it into a second premolar. In second premolar, what you have is two cusps on the lingual, and the groove that was on the mesial is no longer on the mesial, but it's right down the center of the two lingual cusps. It's that simple. And of course the sulus ways are still there. And that's how it goes. The sulus ways come down, interproximally, and the lingual groove does the same thing, and cusps are better formed. So it looks like a second premolar. The root tip is pointed almost and curves distally. If you look at it, it curves distally. When you look at the facial profile, it's also kind of like moon shape, and this is the area where the cusps are going to take the functionality. That's all for now.